Hello, and welcome to this episode of In Discussion With from Pharmacy Update Online. Today, I'm talking to Dr. Catherine Duggan, Chief Executive of the International Pharmaceutical Federation, about the organisation and its priorities for 2026 and beyond. Could you start by introducing yourself?
I'm Catherine Duggan. I am the Chief Executive Officer of the International Pharmaceutical Federation, FIP. I'm a pharmacist and I'm delighted to be in this role and here with you today.
And can you give us a brief overview of your role as Chief Executive?
My role is really to execute the vision and the mission of FIP, ensure that the strategy is enabled and delivered globally. You can see it on my logo. The absolute nugget of FIP is to advance pharmacy worldwide. So we seek to do that by a variety of methods and means with many programs. And under our umbrella are many different types of pharmacists, pharmaceutical scientists, and pharmacy educators. So my role is very varied, very wide-ranging, and the needs of our membership are huge, as well as the wider need of the profession.
Now, could you tell us a little more about FIP? What kind of organisation is it and what does it do?
So International Pharmaceutical Federation is a non-governmental organisation, not-for-profit, set up in 1912 in the Netherlands. It seeks to advance pharmacy worldwide. We have a footprint that is global. We have 160 member organisations that represent individual members, whether they be pharmacists, pharmaceutical scientists, pharmacy educators, technicians, etc., etc. We also have in our membership allied organisations, academic institutions, and observing organisations like pharmacy regulators. Our footprint represents around 5.5 million pharmacists, pharmaceutical scientists, and pharmacy educators. But as well as that, we span the 6 regions of WHO and have regional forums that provide us with a footprint. We work together with our membership based on their needs to deliver their needs and priorities individually, member organisation by member organisation. But additionally, we have several things that we do that can benefit the entire profession inside and outside membership of FIP. So the role is very varied. We've been in official relations with WHO, which I can walk you through a little bit later, since 1948, and with UNESCO since 2010. So we have that role to advocate and promote pharmacy in the sphere of global health, and again, with education and science at our core.
You mentioned the World Health Organization there. What is the relationship between WHO and FIP?
So we have relationships at many levels in WHO. We are what is called a non-state actor in official relations with WHO, and we've been so since 1948. So essentially, we work with WHO to promote and ensure pharmacy plays its full role in global health. We also work through a triennial agreement of work plans as wide-ranging as global workforce, academic capacity, issues around migration, issues around practice, all the way through to essential medicines lists, supporting with humanitarian work and making sure that the work of WHO is delivered in pharmacy, for pharmacy and by pharmacy. With the recent cuts, Christine, it's really important that FIP leans in even harder because the UN is really suffering at the moment with a depletion of staff. So pharmacy needs to step up and step into the space created around that. We had an MOU ahead of the pandemic in 2019, and that's up for renewal this year. We also have a presence at WHO through an alliance we are partners in with the medics, the nurses, the physios, and the dentists. And we have bilaterals and multilateral arrangements with WHO around the healthcare professional workforce. I'm not sure if you're aware, but WHO works on a timeline of its executive board early each new year, and we feed into that with issues of priority for the profession. And then they create the agenda for the subsequent Health Assembly meeting, which happens in May every year. We partake in that meeting officially by presenting statements of policy, both on our off our own back, but also in alliance with our student federation, with our early career pharmacists, with any constituency that we represent in FIP, and with the alliance that I just mentioned to you. And that obviously pushes through their global work programme. And then separately, we would be working on projects that are pharmacy related, evidence of service provision, global health delivery, primary healthcare. We signed the profession up to the Astana Declaration in 2018, which really meant that we had this higher profile with WHO. And indeed, Dr. Tedros would say to us now, upon understanding FIP more, he understands that no health system could create community pharmacy or hospital pharmacy services from scratch now, that we are essential and indeed an imperative for global health. So we view this as our highest stakeholder at FIP, and it provides us with that unique selling point to our member organisations. They can attend the World Health Assembly with us. We can lobby health ministers with and for them. We can get around the table with finance ministers to demonstrate the evidence of our worth and our impact. And we really can present a united front around the important role, the essential role that we play in all elements of healthcare.
I'd like to talk about FIP priorities for 2026 and beyond, and I've picked out a few that stand out for me. But first, could you talk to us briefly about the FIP 5-year strategic plan?
It's really important that we have a wide-ranging strategy, and I'm sure you'll understand that it needs to be everything to everyone. So then what we try and do is work with member organisations and our own programmes of work to deliver some things very concretely. We've aligned our strategic plan to the Sustainable Development Goals. I joined in 2018, and we then published the 2019 to 2024 strategic plan, a 5-year plan. And this one takes us through to 2030, which is where globally we have an ambition to really see the Sustainable Development Goals in action. And the strategic plan consists of 6 strategic objectives focused on current and important issues. I may mention to you that our vision is for a world where everyone has access to safe, affordable and effective medicines. And I'm sure you'll agree, Christine, that since and during the pandemic, we realised that we were nowhere near there. And following the pandemic, we're probably in a worse place than we started from. So the strategic objectives to 2030 start with access to medicines and health services for all. We view this not as a privilege, but as a right. And we advocate for universal access to medicines in line with universal health coverage, ensuring pharmacy services are fully aligned with global health goals. The second objective is about the people who offer person-centred pharmaceutical care and well-being. And these are pharmacists themselves, pharmacy educators and scientists in pharmacy, as well as pharmacy technicians, who are essential to strong health systems. You'll know, Christine, we are the most accessible healthcare professionals. Indeed, in the pandemic, we mentioned earlier on, the lights stayed on in communities through community pharmacy. Everyone else closed their doors. We're committed to advancing pharmacy workforce development by supporting education, leadership and professional growth at every career stage. And every country is at a different stage of development, so we want to progress them all. Indeed, those we might regard as advanced often have a lot of work to do with politics in their nations, funding being withdrawn. It's never finished. We can constantly keep ourselves busy with that work. The third is innovation driving progress in healthcare. And really places pharmaceutical sciences at the centre of that progress through innovation of pharmaceutical science. Again, you'll know, Christine, that the pandemic would still be going on if we hadn't found a vaccine, a way to get out of the pandemic and to live our lives more normally. That work had been on mRNA vaccines had been championed and supported by pharmaceutical scientists and sciences for 60 years. And we were then in a position through collaboration to be able to develop and deliver the vaccines globally, of which pharmacy played a central role. Fourthly, we're focusing on ensuring pharmacy workforce are equipped, empowered and supported to deliver high quality care. And that includes advocating for regulatory frameworks, policy development, both that strengthen the care that we deliver, and the workforce we need. In some countries, pharmacists aren't even defined as pharmacists. And we know that our work at the UN is changing their minds about us being a retail profession. So we have work to do there. The fifth objective is clear and urgent, leading pharmacy's role in the global fight against AMR. It's one of our greatest threats to global health. We strive to play a key role in combating it by promoting responsible medicines use and strengthening collaboration with all the health organisations we work with, partnering with global and regional bodies to develop policies and practices. And the sixth is leadership, governance and global engagement. We acknowledge the importance of strengthening leadership and governance capacity. You'll be amazed at how many countries don't have leadership bodies. They don't have a regulator in place. So we have to support them to start from scratch to develop those systems. And that's not only within, but across global pharmacy and healthcare professionals. And we strive to enhance our ability to serve our members and develop future leaders and make strategic decisions. You'll know, Christine, it's all about the future. It's all about our early career pharmacists and scientists and making sure they feel equipped to carry the mantle forward.
There's a lot more there than I realised. Now for some specifics. Can you talk to us about FIP-WISE? That's FIP, Women in Science and Education.
So I mentioned WHO to you earlier on. The other UN agency that we are delighted to be in partnership with is UNESCO. And they really focus on education, science and culture. But within the UNESCO agreement, we have regional centres for excellence that bring together our academic institutions, which are made up of pharmacy educators and pharmaceutical scientists. So there's a natural synergy there. And within that, the work on gender equity and gender equality, both in the workplace, but also to celebrate women who are scientists and educators. The workforce in pharmacy is predominantly female. Between 70 and 75% of the global profession is made up of women. And yet we don't see women at the top. Christine, I'm the first female CEO of FIP since its inception. So it seems quite important to me as a role model in that area to really champion women. We've got a few big programs of work. One was our program of work around practice settings and making sure these were viable, vital, and that we had good practice. It was called PPP at the time, positive practice environments, PPE, sorry, positive practice environments. But with the pandemic, that soon got usurped as a term for equipment that was essential to health workers. So we gather women together to make sure they share experiences of this. And then one of our hugest success stories, it won't come as a surprise to you, Christine, is a mentorship program whereby we have mentors globally who we pair up with those who would like advice on their career development, their career progress. And whilst the focus of the work started with our program in UNESCO, and we launched it right at the very beginning of the pandemic, when many of our academics found themselves really struggling to be heard, and many of the women in academia were carrying out most of the childcare, the teaching, and all of the demands that had gone on, as well as their jobs remotely. We also see a lot of women who work in different sectors of the profession engaging with our science and education programs as well. So the mentorship network is huge. Sharing best practice is something we do at FIP. And then these gathering best practices together in a way that others can adopt and adapt them for their own use is a measure of success. So it's really what I would call a network program. It's a program of bringing people together, sharing experiences, sharing examples, and all of us advancing together in the initiatives that we would seek to develop.
And now, would you like to comment on health literacy and FIP's work in this arena?
That vision that I mentioned right at the beginning of a world where everyone has access to safe, affordable, and effective medicines actually can't happen unless you have a society where everybody is supported with their health literacy as much as possible. And of course, we have community pharmacists working on the front line with this. We have educators supporting our students and our profession. We have hospital pharmacists working to help carers with medicines use and medicines adherence. But the issue here is about equity. And we can see technologies can improve health literacy, but only for some. We can see that that can enhance inequities in others. We saw this absolutely through the pandemic. So development goal number 10 is our one on equity and equality. And this is where the health inclusivity of health literacy comes to the fore. So it's not just about ensuring people can read labels, that they can understand what their medicine's information is telling them. This is about understanding a patient's journey or a carer's journey during the pathway of an illness. And we see a lot of an individual's literacy may change over time. So you may have somebody who suffers with cognitive, neurological impairment over, for example, with dementia or Alzheimer's. So at that time, their health literacy changes. Maybe their carer is the one who's looking after their medicine. So you need to be thinking about the literacy of the carer as well as the literacy of the patient. Then you've got the whole issue of translations and ethnic minorities and the access points there. Maybe it's a person visiting a community pharmacy who brings in a grandchild who can speak English, but of course they're a child. So these everyday encounters that our profession undertakes really showcases the fact that without a pharmacist at the point of supporting someone with their medicine's use, explaining their medicines to them, explaining the medicine's pathway, the disease progression, then you're really not certain that that person is equipped with the best information for them at that point in time, or indeed their carer. So it's a much more complex initiative than we first thought when it was about access to good information. This is about really meeting the patient's needs head on. And what we've found with this is that our entire profession can use the experiences that they have in their families, in their relations, in their communities to best effect and think about the individuals that we're supporting. And Christine, what we tend to do is support the needs of our membership through maybe some CPD, maybe some online learning, maybe some reading, some reports, some evidence of impact, collations of the literature. So whatever they need at that point in time, we will seek to create that for them. And also just gathering people together to share experiences or share insights into how we can make it better is also a really invaluable way that you can share and showcase that best practice again.
Some useful points there. Now, moving on, I understand that non-communicable diseases account for 74% of deaths worldwide. Could you talk to us about FIP's work in this area?
Yeah, so the UN has defined 5. They defined them around 2018. Indeed, they started with 4, and they're cardiovascular disease, COPD, cancer, and diabetes. They then added a 5th, which was mental health, which again is a bit anomalous because we tend to think of mental health being a good thing, not an NCD. These are non-communicable, so you can't catch them. But with our aging societies, specifically in the Western world, we're all standing a bigger chance of developing NCDs and then also developing comorbidities that sit with them. Those 5 NCDs we signed up to because we realised that pharmacists manage those NCDs in their sleep almost. It's our bread and butter, for which we will be involved in the prescribing in many countries, but also in the administration or the dispensing of the medication. And indeed, when we signed Pharmacy up to the Astana Declaration, we developed 3 major big programs of work for visibility: NCDs, the safety agenda, and prevention. And you could also see the intersection of this, safe medicines for NCDs and preventing the NCDs getting worse. But Christine, the link to the health literacy piece above, pharmacists don't limit themselves to those 5 NCDs. They will manage patients who have all the other silent NCDs, the Parkinson's, the dementia, the osteoarthritis, to name a few. And you see patients who have one or more of the UN-defined NCDs alongside everything else. Our role in supporting patients to live with their NCDs, prevent the illnesses from worsening, and also manage their medicines responsibly is huge. And since 2018, we've really shouted loud about this. The UN had a specific year of the NCD last year. So this year, we've created a big focus to make sure that all their resolutions chime and sing very loudly to our programs of work. and that we can make sure that we are absolutely front and center of every policymaker's evidence base, if you like. You mentioned 74% of deaths. We've counted that in 2021 there were 43 million deaths in before the age of 70. Some 18 million people die from an NCD, which seems astounding, really. We often focus on communicable diseases and AMR, but this is just as much of a critical issue. We've got a long-standing commitment on this. We published our statement of policy. That's almost like our global policy at FIP in 2025. And now we are working to make sure that we absolutely expand the 5x5 approach. That encompasses major conditions such as cardiovascular disease, cancer, chronic respiratory diseases, diabetes, mental health, but alongside tobacco use, diet, physical activity, alcohol consumption, and air pollution. And probably our development goals 3 and 4 really, the United Nations development goals 3 and 4 are really where pharmacy can contribute. And we make sure that the global networks we have are certain of this.
Very interesting. That really puts it into perspective. Now I'd like to turn to communicable diseases, that's infectious disease. Two aspects, antibiotic stewardship and vaccination. Where is FIP on these?
Yeah, we actually have one specific development goal for AMS actually, it's the stewardship element. Because it's such a priority, and you'll see in the strategic plan we have an objective against it. One of the big things in this area is how new drugs are funded, and it's like an inverse incentive for pharmaceutical companies to develop new antimicrobials, but additionally, how can we steward and use antimicrobials to best effect? Last year we published a big piece of work on the hospital setting, global policies and practices, which drew on existing policies from all 6 WHO regions and also built on our 2024 survey. So we constantly survey our membership around all of the priority areas, Christine, and we have this wealth of data kept in our global pharmaceutical observatory. We used those 2 pieces of work then to launch an FIP Copenhagen Declaration on AMR at our Congress last year, which was in Copenhagen. And 82 of our member organizations signed up during the 83rd Congress of World Pharmacy. That set out the global priorities to tackle AMR. International partnerships would be one. We can't do it on our own. Promoting vaccination and responsible use of antimicrobials, safeguarding medical supply chains and medicine supply chains, advancing research on the antimicrobial stewardship and health outcomes. And then we created video resources and promoted this. We now have to deliver that declaration in practice and all the commitments that were inherent in there this year and beyond, and we're well on the way with regional roadmaps to make sure that happens. When I say regional, Christine, I'm talking about the 6 WHO regions of Europe, Africa, Western Pacific, the Americas, Eastern Mediterranean, and Southeast Asia.
Much more to it than you might at first think. Moving on again, could you say a little about FIP's work in relation to maternal health?
Yeah, this one sits under our equity program as well. And we published, when I first joined FIP, there was a publication being launched of women and responsible use of medicine. So not just women in the profession, but in every community, really supporting and championing the role of women as caregivers and care providers in families. But then we wanted to make a specific focus on maternal health, really looking at health in pregnancy, medicines in pregnancy, breastfeeding, and then also through the infant's life, maternal health, really looking at healthcare needs, reducing disparities by understanding complex health inequities affecting mums and their infants, but looking at the opportunities and best practices that exist in certain countries and showcasing and sharing them. You'll recognise, Christine, that many of our countries, of course, are high income. Even though we might all feel fiscally challenged, we understand that we are privileged to live in high income countries, but many of the countries in our membership are low income and lower middle income. And with the removal of US aid last year, some of these geopolitical issues, we're not politically engaged in those, but they have massive ramifications on maternal health and on the health of the family. And we see that a lot as well with our work on war and conflicts and ensuring safe medicine supply there as well. So it's a really important initiative. Again, one that pharmacists have done, but maybe more informally over the years. And now having a particular spotlight on it really helps us showcase best practice and equip pharmacists to support women and particularly maternal health.
Now I want to move on to a different topic, and that is what we learned during the coronavirus pandemic. What were the learnings for FIP around access and equity?
What we did was we formally described what pharmacists and pharmacy had done to respond country by country, region by region, and globally in 10 blocks of 100 days. Starting from around March 2020, we then took a 1,000-day perspective and published our report, 1,000 Days with COVID, around the Astana anniversary in October 2023. So it gave us this really in-depth, but in real time understanding of how responsive the profession was. And this is invaluable because as you were reaching the end of the pandemic as we knew it with all our lockdowns, we had so forgotten how little was known right at the very beginning. This is, I think, a coping mechanism as well. So having this whole program of work looking at 10 blocks of 100 days meant we could really deep dive and see what learnings could be taken so that as and when we move into the next pandemic, which is a matter of time, we will be best equipped for that. And what we really looked at here as well was how pharmacists were supporting communities that had inequities within them so that you could see it was associated, the outcomes of COVID were clearly associated with social determinants of health. We saw increased gaps between the haves and the have-nots, both in terms of access to outside spaces as a very minimum, but also access to services. And this is where pharmacy stepped in. We knew during the pandemic that poor access to healthcare and basic services increased vulnerabilities. So we sought to make sure that every community pharmacy everywhere could be the first port of call, and also to protect our hospital practitioners as well, because they were really at the front end, the pointy end of the crisis. We also had a lot of work looking at protecting the profession as well as the patients themselves. And there were stark variations across income levels within countries and between countries as well. We issued a statement and then informed that informed the work of the WHO, which we really contributed to very heavily. A statement of principle was the impact of the pandemic on health equity, vulnerable patients, as I've mentioned, but also the profession itself. We saw had been a global threat identified by WHO, that weak systems, health, social and governance, high dependence on informal economies, armed conflict and violence, and marginalised and undisturbed communities really and truly suffered. And Christine, I think the sobering point is that we have more of those, we have more risks, we have more of these factors in play now than we did at the start of the pandemic. But we looked at all sorts of populations as well. It was really important for us to publish this work and also to make sure that the WHO knew about it. They were cited on it, and I think as well they have been impressed by that work. Pharmacists right at the very beginning making their own hand sanitizers for patients and the public, having to invest in all the infrastructure of keeping people 2 meters apart in their communities, just being available for all the inquiries. And when people were allowed out, you saw that many of them migrated towards the community pharmacy as a first port of call. So that was really important. But we were also there to support all of the profession wherever they were working, because they all found themselves in stressful, burdensome, highly emotional situations, whether at work or working from home.
Interesting. And now, can you tell us about FIP Humanity RX?
So when I joined FIP, Christine, I mean, we've quantified this, and I can tell you we have 10 times more crises now in a year than we did in 2018. So we used to, if a big flood or a conflict was in place in a country, we would write to our member organisations or contact them and ask them if they wanted any help. Because not only are the pharmacists in that country undergoing the stressful situations that they find themselves in, but they're also service providers to their communities as well. And it became very apparent that over the years and with the pandemic, but then also with all the crises that happened thereafter, we would need a designated programme. This is probably one of our most responsive. We don't have necessarily toolkits on tap to provide the answer to the profession. We were also approached by WHO to work with them to create a collaborative competency framework to support pharmacists working in humanitarian environments. And those humanitarian environments may be as a qualified humanitarian expert themselves and a pharmacist, or it might just be a pharmacist needing to be aware of what you need to do when the humanitarian need is great. It was really important for us to be able to support our individual members how they wanted us to support them right at the point of a crisis, whether it's a war, a conflict, a volcano, a flood, an earthquake, a fire, bushfires, for example. Those individuals just need to know you're there. There's no point in trying to get them on a call because they are busy firefighting, very often literally. So it's really important that we remain super responsive. And this also links to our sustainability development goal, because we see climate change really ramping up a lot of these disasters. But really empowering pharmacists and pharmaceutical professionals to respond effectively during these crises is really important. We've learned a lot as a team. I also have a team who are based in a lot of countries themselves going through crises. And we also have members in every single one of those countries. And that's where you need to be a little bit humane. And it plays into, they put yourself into somebody's shoes approach. So you listen to your team members, or you listen to the member organisations or the individual members who are going through these terrible crises, who have lost everything, their businesses, their homes, family members. And it really does make it a sobering point to really think through how lucky many of us are living in privilege. One of the most proud moments, I would say, was watching a young pharmacist in 2019, back then, receiving an award for setting up vaccination services for pharmacists in refugee camps in Lebanon. And that person got rewarded for that, or recognised for that work. But the best thing about that was set up, and then we were able to roll that out across the countries that during the pandemic had refugee crises. And of course, these refugees were living in the midst of a pandemic as well, and since then. So there's the whole messiness of a conflict or a disaster, the whole refugee issue, being able to support pharmacists with translated materials to support the refugees and their communities, but also their families as well.
Now I want to look at FIP from a different angle. What is the benefit to individuals of joining FIP?
Well, Christine, our background back in the day comes from being a member of UK CPA. So you and I would know the benefit of being part of a network of like individuals or people you can share knowledge or even inquire how to do things with. Expand that notion to a global network. And there's something about being able to share experiences and expertise. I joined FIP. I went to my first FIP Congress back in 1992, and I still have some of my closest friends from that time, and I've made friendships along the way that are second to none. So making friendships, but also sharing best practice, sharing what you know or what you find difficult in your practice with others, gathering expertise from them. Every single person who's part of our individual membership can avail of being part of a section that kind of describes where you work, traditionally community, hospital, industry, academia, but also areas of special interest or being part of a development group, an advisory group. We also have a hub where our development goals attract individuals who are interested in the equity programs we just spoke about, or sustainability and climate change, or academic capacity. And there's loads of routes for you to get involved in. Be part of surveys, be part of data collection, take part in our insight boards, but also listening, learning, being part of our communication structure, and sharing your stresses and troubles around developing services, getting them funded, getting them recognised. This is part of the tangible benefits, and the intangible or the innate is the friendships that you make, and it's really important that we recognise that, especially in the time that we're working virtually, and especially in the time where we are global citizens. Having friends across the world really pulls you together in a new way. We've got lots of continuing education, we've got different symposia, we've got different ways to offer advice and expertise, and also programs. And we've got our International Pharmacy Journal, which is like our newsletter magazine. We've got our Pharmacy Education Journal, which is peer reviewed. And we also have webinars and workshops and seminars and abstracts and presentations and lots of things that help you along your career as well, potentially.
You have had a series of jobs in pharmaceutical organisations rather than being a frontline pharmacist. Can I ask you to reflect briefly on how your education and experiences have fitted you for these roles and what makes them professionally rewarding?
Yes, and I also just want to say that when I started after my pre-reg, my PhD, there wasn't funding at that time to undertake a PhD full time in the area that I was undertaking it. So I didn't realize it at the time, but having a portfolio of roles at that time to basically to finance me held me in such good stead, so that I had an understanding of community, hospital, academia, not industry. I never worked in industry, but policy, and then regional services, which is a particularly English and UK term. Having that, moving that into the Royal Pharmaceutical Society position helped me no end, because you had to understand what an individual would need on the ground to be able to speak to them. And then moving from RPS into FIP, where I've got to work with organisations and individuals, I think having all of those levels of experience, and may I say some customer service training from community, even more than hospital, that's really customer facing, has held me in good stead. It's only now I look back, Christine, I think that all of those steps in my career make sense now when I am in this position. Having the ability to say, okay, there's something coming in the door, I have to manage it. I'll say yes if I can, and I'll say maybe not now, but here's when, to most inquiries. That comes all the way from back at the start of my career. And having the research acumen to be able to say, let's investigate that to the nth degree and make it really robust, or let's do a piece of descriptive research which won't be super robust but will tell a story. Understanding data, I think, really has helped me. And then that whole thing about policy into practice, don't wait for it to be perfect, for it to be good. This is just, it just helps. The countries who feel they're so far behind, but also countries that are further ahead and then find themselves in these policy discussions where everything's stripped from them. The ability to go, well, I just need to make this little tweak and we can have success is so important. Yeah, it's the best job.
And finally, do you have a closing message for pharmacists, be they frontline or otherwise?
So I think that there are 2 or 3 key messages for a pharmacist. No matter where you are, we need to, without being arrogant, be fully aware of our worth and our contribution. The fact that FIP represents pharmacists no matter where they are, from the drug discovery all the way through to delivery, all the way through to the supply chain, all the way through to patient facing, all the way through to research and education, is absolutely astounding. The second thing is the career of pharmacy, with that breadth of expertise that we come to it with. Not least, you may specialise later on in your career, or even, you know, at an early stage. You can cross sectors very easily, and this is something that many in other professions just don't have the opportunity to do. We see in healthcare, many of our other professions have to go all the way down the mountain of specialty to go across and go all the way up. We carry with us a lot of transferable skills that are highly, highly valued and valuable. And the third piece is not to wait for perfection to stand in the way of good. So where we have evidence of impact, to be confident about that, We don't need to have produced PhD theses on every single thing. We need to be able to compel policymakers to understand our intrinsic and extrinsic value to healthcare. In the words of Dr. Tedros, no health system would be able to fund pharmacy in communities if they didn't exist already. And that goes to all of the return on investment of having pharmacists wherever they are on that medicine supply chain: education, science, practice, community, hospital, industry. Without pharmacy, we don't have healthcare. And that's the mantra I think we should all be really proud to deliver.
Dr. Catherine Duggan, thank you very much for talking to us about the work of FIP. That really has been fascinating. For more information about Dr. Duggan's work, please visit the website using the links in the description. And be sure to subscribe for more news, videos, journals, and podcasts. And thanks for watching.